Hi, thank you for joining me for another one of my gigs. I'll be talking to you about genetic testing before you fall pregnant or in early pregnancy. So stay tuned after this. There is now a national recommendation to consider genetic carrier screening testing before you fall pregnant or in early pregnancy. Currently, we routinely recommend testing for the 3 common genetic conditions: cystic fibrosis, Fragile X, and spinal muscular atrophy or SMA. Now, these are serious conditions that may have treatment and interventions, but no cure. In the general Australian population, this is the frequency of carriage. So let's have a look at SMA, for example. What this means is there's a 1 in 40 chance that you may be a carrier for the SMA gene, and there's a 1 in 40 chance that your partner may be a carrier of the SMA gene. If you're carriers, you're generally healthy. But if you are both carriers, there's a chance that you can both pass on 1 copy of the gene to the baby. Baby ends up with 2 copies of the SMA gene and ends up with the full-blown SMA disease. When we screen, we usually start screening from the mum. If the mum is not a carrier, then we don't need to test the dad, because even if the dad is a carrier, there's only 1 copy of the gene between the couple. So the baby will not end up with 2 copies of the SMA genes and therefore will not have the SMA disease. If the mum is a carrier, then we'll go back and test the dad. If the dad is not a carrier, then once again there's only 1 copy of the SMA gene between the couple, and the baby will not inherit 2 copies and therefore will not have the disease. If the mum is a carrier and the dad is also a carrier, then the baby may end up inheriting 1 copy from the mum only and end up as a carrier, or end up inheriting 1 copy from the dad and once again be a carrier only, or the baby may end up inheriting 1 copy from the mum and 1 copy from the dad and therefore end up with 2 copies of the genes and have the full-blown disease. So if we do know that both the mum and the dad are carriers, then we can test in pregnancy to make sure the baby doesn't have 2 copies. Or alternatively, they can undergo IVF with genetic testing to make sure the baby doesn't carry 2 copies of the genes before transferring the baby back into the mum's body. But we won't know to do either of those things, to test in pregnancy or do IVF genetic testing for the disease, unless we know both mum and dad are carriers. And that's why we recommend genetic carrier screening before you fall pregnant or in early pregnancy, so we can identify the couples that are a higher risk of having a baby with these diseases. The current recommendation is for the 3 common diseases, the cystic fibrosis, Fragile X, and SMA, in reproductive genetic carrier screening. But there are other tests that test for a wider variety of genetic conditions. Some tests will test for more than 200 genetic conditions, some more than 300, even more than 500. And that's a lot of genetic diseases to screen for. We don't routinely recommend these wider genetic panels in the population unless you're part of a higher risk population or if the couple has a higher risk of carrying genetic mutations. These genetic tests also have cost implications, so you should talk to your GP or your fertility specialist for more information. So I hope this makes it clearer for you about the choices you have for genetic carrier screening testing before you fall pregnant or in early pregnancy. Thank you once again for joining me, and I'll see you next time. Bye.